Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I'm chatting with Dr. Gail Bagwell about her upcoming presentation titled Implementing Safe Sleep for Babies in the NICU. Welcome, Gail. It's so good to have you here.
Well, thank you, Kristen, and thank you for inviting me today.
Oh, it's wonderful. You, of course, are part of our Gold Neonatal conference coming up here. It's just around the corner in just a little bit. And before we get to talk about your topic here, implementing safe sleep for babies in the NICU, which I'm very curious about, let's first tell me, where in the world are you?
I am in Columbus, Ohio. I work at Nationwide Children's Hospital, which is a large quaternary referral center for children and babies specifically. I'm a neonatal nurse throughout most of the state of Ohio. We have a very large referral area in Ohio, as well as neighboring states and across the country and world.
Absolutely. Yeah, it's quite a famous place. Yeah, absolutely. Well, thank you so much for sharing that. I know you're also an educator. You educate other healthcare providers. So tell us a little bit about that role as well.
So I am a clinical nurse specialist, which is an advanced practice nurse. And part of being a clinical nurse specialist is to provide education as well as collaborating on projects and consulting and doing evidence-based or research projects. But in the education role, I do it with part of the neonatal outreach, perinatal outreach program here at Nationwide Children's Hospital, where I work with healthcare providers that refer their babies to our neonatal intensive care units. So I get to travel within the state of Ohio, sometimes across the border to West Virginia, which I love because I was born down that way.
Oh, that's nice to get to go over.
So it's kind of like going home.
Going home.
But yeah, I work with them on how to take care of sick babies, how to stabilize them prior to being transport to a higher level of care. I also work with them just on normal healthy babies. You know, a lot of times they utilize our services as part of their orientation programs on newborn assessment, stabilization, neonatal resuscitation if they don't have their own NRP instructors. And myself and partner will go down there and work with them, make sure all their providers are competent and able to do resuscitation. And we also work with them on some quality improvement projects to help them improve the care that they are providing to the babies. We have a database they can submit their information to, and then they can compare themselves to like hospitals.
I like that. That actually really speaks to me a lot, because I feel like there is always room for improvement, obviously, right? But tell me a little bit more about that aspect, what you've seen, where you have seen anything that led to change.
So when we started this little collaborative among our referral hospitals, they actually did like the metrics that we started with were ones that you would see in the delivery room and right into the nursery. So looking at, did we start breastfeeding right away? A lot of people were not getting the babies to the breast within that first hour. So many of the hospitals worked on projects to improve getting babies to the breasts or moms pumping within that first hour of life. Checking glucoses. Did they check glucoses at the appropriate time? Did they notify the physician when the baby had met criteria that they would need to be worked up for sepsis? Did they, so those are just a couple of the metrics that we have seen people work on. Thermoregulation was another one of what the baby's temperature was.
Fascinating. So that's wonderful news there, that there's always room for growth and change and improvement. Absolutely love it. You are also a published author, and you have the book chapter in all 6 editions, I've learned, of Kenner's comprehensive neonatal care textbook. That is quite something there. And what other books have you published, or what other publications have you done?
I've done a couple of manuscripts. And I've also participated in now you're asking me off the top of my head. I can't tell you all the books names, but
Yeah, it's quite a comprehensive
Kenner
list, right?
has a neonatal handbook that I contributed on the neonatal absence syndrome chapter. I wrote that. I also, with one of my former physicians, wrote a newborn physical assessment chapter for an encyclopedia of child and adolescent health book. So I think those are the most important ones.
And
You
you're
had
the
that one.
editor of the NAN guideline for newborn safe sleep, right? And also you've published multiple journal articles on the topic, and that's why you're here presenting for us at Gold on implementing safe sleep for babies in the NICU. I mean, safe sleep, it's always a very big topic, right?
Yes.
So I can imagine that babies coming out of the NICU, they are, you know, probably more at risk. So tell us a little bit, number one, what you know, a little bit about the presentation and what you hope in the end viewers will take away with.
So the presentation is really going to talk about safe sleep and infant deaths during the sleeping period. We're going to start out with just a little bit of history. This is nothing that is new. This has been around since biblical times. So we'll talk about that. We're going to discuss current statistics of sleep-related deaths in the United States. We're going to learn about the different types of sleep-related deaths. Most people will say SIDS, and actually very few of the deaths are SIDS deaths, and we'll talk about why and what a true SIDS death is versus the other types of sleep-related deaths. We are going to discuss the AAP recommendations for how to prevent sleep-related deaths in our babies less than 1 year old. We're then going to dive a little deeper and look at the NICU. What do we know about our NICU babies? We are going to talk about what we should be doing as healthcare providers, talk about role modeling. We're going to talk about how to work with the parents. You know, so many parents, or I should say almost all parents now, are using the internet and social media to get their information. And, you know, we need to learn to work with it and not against it. So some tips on how to work with it and not against it. And then, you know, do a little bit of wrap up and have time for questions.
Perfect. Yeah, the internet, and you and I chatted before this little recording here before that. The internet is a wonderful place for connecting people, especially like new parents when they feel isolated, and they can reach out to others and having that kind of connection. However, it's also a dangerous place, and information up there, as we all know, is not reliable. And
right,
the so-called experts and
definitely.
yeah. So, but again, and you are absolutely right. We cannot work against it, because telling a young parent, oh, you know, don't look at social media, put your phone away. We know it's not going to happen. You know, it's not going to happen. So instead of working against that, what can we do to really, you know, use it to the advantage and work with parents and meet them where they are, really.
Right. Very much so. You know, because otherwise it's like stopping your car, as I said to you earlier, on the freeway and starting to ask everybody what their opinion is. And, you know, when you think about it, it's like, I would never do that. But being on the internet and social media is equivalent to that.
It is equivalent to that. Yeah, thank you for pointing that out. That's a really good example there as well. Gail, before I let you go, any last words for our audience here with regards to the topic?
No, I think it's a really important topic, and one that we don't always focus on and the NICUs, because our babies are so sick. And I think the biggest problem is, when do we start transitioning to a safe sleep environment, which is still a very big question. We'll talk about why that is still an unanswered question. But yeah, it's an important topic, and we need to do our job, because premature babies are higher risk for sleep-related deaths than term babies are, but term babies have been sick also. And it's going to take the entire village to help improve our infant mortality statistics in the United States. And this is just one component of it.
One component of it, and it takes a village. Love it. Thank you so much, Dr. Gail Bagwell, for meeting me here, chatting about all the amazing work you're doing in the hospital, also for other healthcare professionals, your books, your contributions there to research, and of course the presentation here at Gold for the Gold Neonatal Conference. Thank you so very much.
You're welcome.
And now for our audience, if you are curious now and you would like to find out more about Gail's presentation and all the other presentations in the Gold Neonatal online conference, we invite you to go to goldneonatal.com. Yes, these are all live presentations, but everything is also recorded. So if you cannot be there live, everything is recorded, so you can watch the recordings at a time that's convenient for you. So we hope to see everyone at the conference. Bye-bye, everyone.